All right. So the point I wanted to start with is this is a challenging time in the history of our nation. It's a challenging time for the civilizing values of a democracy, for the health of our people, and for the health of all people, and especially for people of color and those who are poor. But what is important to also know about our fight is that finally, we actually are, as a nation, all in this together. It used to be that drug overdoses and all those kinds of problems were black problems. They were minority problems. But then all of a sudden, we looked up right before COVID, and here we find that America seems to be having a problem. Even, quote, good families seem to be suffering from the overdoses of opioids. All of a sudden, the diseases of despair are no longer segregated to people of color, but now they are American issues. And all of a sudden, they get a bit of attention because now we're all in this together. And so we see also our brothers and sisters from the Jewish community being attacked on city streets, our Muslim brothers and sisters being attacked everywhere. We're seeing people of every ethnicity and nationality. Our Native American brothers and sisters, all of us are now in the same boat, struggling together. What we need then is a rededication to the larger purposes and transcendent values that are at stake. We need to be a rededication to love and a respect for life. Let me be clear, this is not an idle proclamation. What I am saying to you is that we have to somehow transmute our sense of suffering, our sense of pain, our sense of learned humanity to the rest of this nation. There is no solution ultimately to our problems that is not going to ultimately be based in love. And so we have to have a rededication of a respect for life. Black lives must matter, no question about it. But hear me well, Black Lives Matter must also matter to us. And they have to matter to us more than a t-shirt. But I will also say this, and I want to be careful in how I say it, because everything you say in this hyper-polarized days is very complex and can be dealt with. We also must have a respect for all life. We are not in this by ourselves, and as long as the fight for black health is ghettoized, off to the corner, it's this thing we do kind of extra, as opposed to center core, we will always be short and deficient and won't get to our goals. This is an American fight, and we have to put it into a larger context. I have an undying love for black people, an undying love for black people. But through that, I have an undying love for all people, and we must put it in those terms. How many deaths are we willing to tolerate in this country? What exactly is our commitment to a civilized modern democracy? Well, we have seen in Texas somebody who is a leading public official there who simply says to old folks, "The hell with you. You're in the way in this COVID pandemic. Go ahead and die. You're in the way of the economy." And he was not run out of town on a rail. It wasn't a big problem in his state that he could stand up and say that. Well, you are facing that right here in this great state of Florida, aren't you? Where you apparently, I found out today, have a Surgeon General who's made a decision that says that children in Florida should not get access to the COVID vaccine. I looked up the statistics and I am made aware that slightly more than half of all the children under 5 in this state are black and brown. I am aware that the governor of this state did not, and is the only state that did not order the vaccines for children, deciding for political purposes to take choice out of the hands of Florida families who wanted to get back to family values, who wanted to have the celebration in the house with grandma and the immunocompromised uncle and the at-risk other member of the family. They wanted their kids to be able to go on vacation without having to wear their mask or being afraid, and they took that choice out of their hands. A 13-0 FDA approval yesterday on the safety of that vaccine. And this health commissioner apparently thinks that he is smarter and knows better science than all of that other apparatus in this country. You have choices to make about political expediency over science and the health of the population. How many deaths are we willing to tolerate in the Black and minority community? We have known since the Malone-Heckler Task Force of 1985, we have known what the toll of disparities really is. We know that 60,000 people back in '85 were dying prematurely and unnecessarily simply because of the conditions of people of color. And look at the things that cause it. What is common about all of those elements? They're the choices we make and the chances we take with our lives, combined with the environment in which we live, combined with access to health care. But very fundamentally, and what I want to lock in on here, is the choices we make and the chances that we take. How many of our lives are we prepared to be comfortable with? We know that because of the pre-existing conditions that are on that previous slide, we know that that was the setup for the disparate impact of COVID-19. We know that because we had the pre-existing conditions all across our communities that we were unable to tolerate the virus once it entered into our body as well as others, and we saw what happened. And the result is, unfortunately, that our life expectancy gap widened each of the last 2 years. And now we see that for Hispanic brothers and sisters, a 3-year decrease, and for us, almost that much at 2.9. We went into the pandemic sick. Because we were sick, the pandemic was worse. Because of the pandemic, we are now sicker. The agenda for this group is more challenging today than before the pandemic. We cannot afford to be tired. We have a lot of work ahead to do. How many deaths are we prepared to tolerate? What have we learned? What we have learned from this pandemic are very painful lessons about our society. We have learned that the people with whom we share our time and space in extraordinary numbers could care less about us. You can be on the city streets, and there are people there who will be very clear that their right not to wear a mask and not sicken and kill you is more important than whether they do sicken or kill you. The callous indifference, the political sloganing around all of this was simply extraordinary. Our self-absorbed narcissism. We've learned that there is a profound distrust of social institutions and of medical institutions. This is fundamental for the foundation of the work that has to go forward. Very, very frightening. We have learned through this experience that there are significant complications of long-standing issues, as I've discussed before. But what we've also learned is that we have this legacy, of course, of structural racism that has been so overwhelmingly profound and that we will have to confront. Well, how did we get to this place? How did we get to this notion of where we are? The health commissioner of the great state of Virginia has just decided to tell his people that he doesn't believe in structural racism, that this is all about only personal choice. This is only about whether or not you decide to take whatever actions that we should be taking, which you cannot get away from. There is no disagreement about personal choice and accountability. None. You cannot have any disagreement about that. But to imagine somehow that the context in which you live your life, the chances that you have to optimize those personal choices is fair and even is an absurd notion. To think that all of a sudden, all the problems have now gone away. And we cannot have that. And so he believes that we will start over. We will start over. And that we just will make it like it's a blank slate. And he's going to fix maternal and child health without dealing with any of the social conditions or the environments which cause black babies and mothers to die. We're just going to have a new kind of public health magical thinking. So we have to teach him how we got here. We're going to have to teach him this legacy. I'm going to see if now I can bring up the main slides because it has some videos that I want to get to very quickly. And I think that we might be able to, no, we can't. Okay, that's fine. So, how did we get here? Well, we know that the historical roots of racism are so clear. We know that we were enslaved for 250 years. I'll let you look at the slide. I can't quite see them, unfortunately, so I'll let you look at them. But just look at the legacy and the history. There are very few people in this country who understand these numbers and these realities. So while we were enslaved, multiple generations of white people were growing, putting money in banks, buying land, prospering. Then when we were so-called free in the Jim Crow era, although we weren't free, we weren't able to vote, we had the chance to own land, and then it was taken away. The tax games were played to steal our land from us. While we were struggling with all that, another 5, 10 generations of white people were moving forward, building up their wealth, and you just keep going through this legacy. While we were struggling to try to get 125 years ago, when we are dying, white OBGYN is having a statue erected to him as the father of OBGYN, who did all of his work on unanesthetized slaves. Unanesthetized slaves. Tuskegee experience, which I will be coming back to shortly. We know what happened in that experience where black men with a disease were denied access to the treatment that would have cured them and saved their lives. We understand that legacy. We understand the legacy of 50 years ago when a lot of us, and I can't imagine that I am of an age where I can say 50 years ago I was fighting in my 20s for affirmative action to get black students in medical and dental school. And that fight has been going on for 50 years. The total number of blacks in medical school today is still about 5%. The number of women in medical school today, 50%. And nothing against women, glad for them. Happy to see they won. How come they won and we didn't? What was the deal? What's happening here? And so we look at those things. We look now at this constant reality today where we have discrimination in housing, food, jobs, but we're also seeing, of course, the impact on healthcare because of what's happening with the criminal justice system and the police attacking young black men in the streets. When that is not, Black Lives Matter is not a political statement. It is not a criminal justice statement. It is a statement by people who are saying, my life and dignity matter. Don't let them co-opt that agenda. Do not let them co-opt that agenda into a political thing. Well, it's this or it's that or it's this or... No, it's about people who are standing up and saying, I matter. If I don't matter, then why do I trust anybody in this healthcare system? Let me then move towards this other issue really quickly before I get to the solutions issues. And I do want to talk for just a second about structural racism. Structural racism is really, really something that we've got to figure out how to get it out of the political system and make it really part of the conversation in a meaningful way. The politics of structural racism drive you crazy because they put us in a box by making it seem somehow that it gets lumped into woke thinking or all that other kind of stuff, as opposed to the reality that structural racism is a system in which public policies, institutional practices, cultural representations, and other norms work in various reinforcing ways to perpetuate racial group identity, so that these elements work very well together to create the conditions that continue. I ask you this, how many times have you been in a meeting where people are talking about food deserts? They've been talking about food deserts and food deserts and food deserts, and what are the special things that we can do to overcome food deserts? Well, why don't we just fix it? Why doesn't anything ever change? Have you ever sort of wondered what the issues really are with that? Why is it that the insurance companies will redline the ability to create a grocery store with fresh fruits and vegetables in the black community? Does that just happen by accident? Is this just a coincidence? Is it a coincidence that the capital funds aren't there? Is it just a coincidence that you can have those stores work in suburban America, but they cannot work in African American America? So we do things like food banks. Great. Love food banks. Love community gardens. Wonderful stuff. Keep doing them. But is community gardens the solution at scale to our problem? I don't think so. And so what we've got to do is to be able to, by the way, guys, thanks a lot for stepping in and fixing this for me. But food gardens are important. We should keep doing it, but we've got to stop jerry-rigging around the edges is what I'm trying to say. Let's confront and bring into the room the capital people who are responsible for creating food deserts. Bring in the largest grocery chains that we can find, and let's bring them in and let's get down and dirty over the rate limiting steps for why we cannot seem to get that problem resolved. We are too timid in what we do. And so all of this finally leads to this issue of trust and distrust. That's why I'm so pissed off, I'm angry, disappointed about the combination of all of the insults that are happening to us. Because trust and distrust is important. I wrote an editorial in Science magazine in the early stages of the COVID pandemic. And my thesis was that we are suffering from the disease of distrust. Distrust is a disease in and of itself, and it is lethal. If I don't believe you, and I don't believe the science, and I don't believe in the institutions of the society, why would I take their advice? Therefore, I will not act in my own best self-interest. And that is the real issue that we've got to overcome. This issue of trust and distrust is important. Well, what are we trying to achieve? You've seen this before. You know this is our goal. Let's make this our goal. A state of complete physical, mental, social well-being, not the absence of disease. The enjoyment of the highest attainable standard of health. One of the fundamental rights that every human being should have without race, religion, political beef, economic, or social conditions. This is our goal. Our goal is to try to get health equity. For those of you that don't know the difference between equality and health equity, take a look. It's very simple. Either everybody gets the exact same regardless of what they need, or you get exactly what's needed to get you to solve the problem that you have. It's a very straightforward equation. Obviously, what we're looking for is to get the notion of equity, where that each and every person has different circumstances, but we give them what is needed to be able to have them succeed. And that becomes important. So this notion of equity, genuinely non-racist society, what would that look like? The distribution of society's benefits and burdens would not be skewed by race. A reality in which a person is no more or less likely to experience society's benefits or burden simply because of the color of their skin. This is in contrast to where we are today, obviously, where a person of color is more likely to live in poverty, to be imprisoned, to drop out of high school, be unemployed, experience war. Listen, folks, all these health professionals in this room, we're not dumb people. We come from intelligent, wonderful, smart people. The fact that we find ourselves year after year in the situations that we're in, it's not because we're somehow flawed human beings. It's the reality of how we live in this society. And we have to understand, we have to get to it. Well, how do we get to where we want to go? It starts out with love. I am very hopeful that with love, this slide will play. I am praying.
Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. We urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. But tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/loveletter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
So you can tell that that was something that we did right early in the pandemic. And we knew that we had to talk to our community, particularly those who disagreed with us because of the misinformation, because of the deliberate poisoning of our community with misinformation, wrong stuff by the Proud Boys, by the Russian bots, and by other racist groups. We were targeted. And we knew that it was going to be a challenge to get people to participate in clinical trials and in taking the vaccine. So we got the 4 Black medical schools, Howard, Meharry, Morehouse, and Drew, the National Medical Association, the National Black Nurses Association, the National Urban League, joining us as well. But we put all of America's leading Black talent in medicine together and our community groups. And we said to American Black community, we love you and we care about you. So we will have a conversation that may be difficult, but we're going to have it. For those of you that are organizing, the Black Coalition Against COVID, when we did that, had 0 budget, no dollars. We have always been amazed in our work from a standing start, Easter Sunday 2020, with no staff, no money, no budget, no nothing. We were able to launch these campaigns simply by just deciding to do it and reaching out to everybody we could find, calling every organization we could call, and we found this production company that put this together for us, and we were so grateful for it. But the bottom line is, we have to begin in love. So where do we go from here? How do we get where we need to go? First of all, we've got to discover a shared vision of respect for human life. Not just black life or minority life, but for all life. What happens, we have to help America to understand and work its way through the dilemma that it is under. This is an incredibly difficult, unprecedented moment in American human history. What happens when nothing is true anymore? What happens when all the myths of American exceptionalism have been blown away? What happens when the Statue of Liberty standing out there saying, welcoming your all and all those in need, is suddenly said only those from certain places with certain colors of their skin? What happens when the myth of the value of a free and independent press is gone? What happens when the myth that key institutions of society can be trusted? We will have to help reestablish a nation that is based upon larger purposes and transcendent values. The values that say that every human being deserves the right to live and to be free of preventable misery and suffering to the greatest extent possible. We have always been the moral conscience of this nation. Reverend Dr. Adams, Dr. Reverend Adams, whichever way you want it, quoted Martin Luther King. How many times in American daily discourse does Dr. King come up? Over and over again. Let us translate our pain, the unnecessary blood on our white coats. Let's transmit that into informing those Americans who are still alive enough to be human, who are still alive enough to be civilized. Let us not be so angry that we fail to connect at the level of humanity. Let us be the saviors of this nation and get it where it needs to go. Number two, we have to create a shared vision for health. We have to understand and prioritize the conditions necessary for optimal health. I was impressed by Reverend Dr. Adams, who says that you all went through a meticulous process to pick the 3 things that you wanted to choose to be engaged in. Let that not be an idle pursuit. We need in every one of our communities to have a conversation about what is killing us and what's most important for us to address, and then mobilize the assets and resources that we have in our community to address them. Every community, no matter how challenged it is, has strengths. And we have to stop looking at black communities and Hispanic communities from the context of their deficits. We're not problem people. We may be people with problems. We may be people with problems. We are not problem people. And we have resources and we have assets. So let's do what is done here. This brilliant idea that you prioritize what we are and then organize our resources necessary to be able to address our key challenges. Number 3, we got to come to understand of what is required to be fully realized selves. I have been beat up every day of this COVID pandemic by black people. I have been on every radio show, TV show, talk show, town hall that you can imagine, every call-in. And I will tell you that you just get excoriated by people. Well, you know that vaccine is the devil's poison. You know you're in league with the white man because you are giving people this vaccine. You know your left arm is going to fall off and you're going to grow a third nose. You just get so yelled at, so beat up by the forces who are against you. You got the Kyrie Irvings out there as basketball stars. You get a nut lady who's a singer who says that, you know, that a friend of hers who was a friend of hers who was the 3rd generation on the left-hand side of the street had his testicles swelled up because he got a vaccine in Trinidad. And we spend 3 days trying to overcome that craziness instead of doing what we need to do to save lives. My point is this. Everything cannot always be the problem of the white man. We got to take accountability for ourselves. Now, if you say this out loud, then all of a sudden they're going to yell at you again. You just apologists, whatever. They call you all kind of names. At the end of the day, I wish the racists would just tone their thing down so we can have our own conversation in the family. And in the family, we have to decide, how do we deal with this issue of accountability for what we do? And so that means the autonomy of the decision-making ability of the individual and the autonomy of an individual to make decisions means they have to have the ability to make decisions, which means that the environment in which you live, you have some control over it, which means you have something to do with governance. So yeah, for the attorney general, the health commissioner of this state to say, I don't believe in vaccines for children, there has to be some mechanism that we can overturn that so that our children for July 4th picnic can actually go have fun with grandma and grandpa at the barbecue and not have to worry that that kid is going to die or get sickened from a disease that will lead to complications that we still are learning about. How then do we learn about governance? And so the politics of this state and the political movement needs to be co-joined intimately with the health movement. And the health people have to know the political people, and the political people have to know the health people, and we have to be all in it together in a fight for life. Not a fight to be angry at DeSantis, but a fight for life, leaving out the negatives and the hate and the vitriol and fighting only for love and for human survival and fighting for the future of our children. We have to participate in the governance that allows people to make choices. How is the parent going to make a choice about protecting their child if they can't get access to the vaccine? So we have to deal with that. And we have to bring that element forward. And I tell you this, having been in this state today, I am going to make this a major priority for everything we do at the Black Coalition Against COVID. We are not going to leave you alone. It boils down to choices. It boils down to the choice and purpose and vision for the society as a whole, the choice or the ability to choose of the individual, the choice to approach things from the perspective of victim or empowered. Listen, I ain't nobody's victim, and I ain't gonna be nobody's victim, and nobody's gonna ever put me in victim category. I am too proud as a black man. I'm too proud of where I come from. I know who I am, and what I am not is I am not anybody's victim. And I will not be. I will not be. I'm going to keep fighting as a dignified black man, just like all the rest of you. We have the decision to choose to struggle alone or with others. And so I am reaching out to every white person, Native American, Hispanic, all of us together. This is not a fight that black people can win by themselves. It's impossible. And so we have the choice to either be pissed off in our corner or reaching out with love to everyone around us in a coordinated fight. The choice also is to engage or not to engage in the fantasy myths of what the nation stands for today. I was very, very impressed by this little noticed announcement right before the pandemic. The leaders of America's corporations came together and said, maybe return on shareholder value is not the number one thing that we as CEOs should be judged for. Maybe it is our commitment to what we do in community. I fell over, I had to make a slide. The Business Roundtable, that's Jamie Diamond of JP Morgan in the middle of that slide. JP Morgan is saying we've got to think about corporate social responsibility as maybe as important as return on shareholder. We need to connect. Y'all need to go to every big corporation in this town. Pull up that from the Business Roundtable. Just put in CEO Pledge of Social Responsibility. Go down there, knock on the big people's door, the high rise, the 88th floor, looking out over the world, and say, were y'all serious? Did you really mean this? Because we're here to call the question with love and respect and partnership and collaboration, because we have some needs that we got to deal with. And I wonder if you will be turned away. So yeah, we need to do that. Number 4, where do we go? Black health professionals, we have to step up. We already have, but we got to step up more. It's hard to imagine. I'm looking at 2 of my brothers here now, Washington and Adams, and I'm looking at these brothers. These are people who spent their entire lives learning their craft, learning their science, studying late at night, burning the midnight oil, 8 bazillion exams to go through, competing with the best physicians in America for thought leadership in our space. And yet, one dude on TikTok who didn't graduate high school, never read a science book in their life, has more influence in the black community than all of us together. You don't believe me? It's true. It's true. One TikTok influencer who says the vaccine will make your hair turn purple and your nose backward will have reached more people more effectively than all of us together. How did that happen? How did we get so far disenfranchised from the core, from the heart of our community? That's on us. That's on us. We have got to change our behavior. Our friends are all people just like us. Who do we hang with at the golf course? How do we spend our time? Maybe if we're lucky, we see some folk at church. But the people that we really need to reach ain't in church either. They're not in the Boulé. They're not in Jack and Jill. Now, we do real good with Jack and Jill and Boulé crowd. We do great with the golf course crowd. But our people, our core, we're not there. We got to change our behavior. We got to change our behavior. We didn't do all this work to have it thrown away by some knucklehead on TikTok. So we created the Black Coalition Against COVID. You see the crowd together. You know how hard it was to do that? Let me tell you how hard it was to do that. Ring, Dr. Frederick at Howard University, we're forming this thing together. We got to save Black life. Are you in? Yes, thank you. Look, Dr. Valerie Montgomery Rice at Morehouse, hey, we got to do this thing. Are you in? Yes, I'm in. Do you care about who gets credit? Do you care about who's in charge? Do you care about whether or not your institution? No, I don't give a damn about that. I want to save Black life. Thank you. Boom. You understand what I'm saying? Dr. Carlisle, Drew, hey, you in? In. Boom. Every single person that I called on Easter Sunday, 2020, by the time I got to Monday morning, it was already done. These are the kinds of good people we've got out there leading, who don't care about credit, who aren't worried about what, and basically, and didn't ask where the budget was going to come from, what money involved. We just did what had to be done. Was it perfect? No. Can we do better? Yes. Can we do more? Yes. Am I saying this is the end all of end all? No. What I'm saying is just do it. Just get out there and make it happen. And so we did make it happen. And so we connected with minority physicians. We decided that one of the first town halls we did, we picked up the phone and called the National Hispanic Medical Association. Hey, you in? Yeah. Called the Asian Pacific Islander Medical Association. Are you in? Yeah. The American Indian Medical Society. Are you in? Yeah. Everybody was in. All you had to do was make the phone call and cook them up and make it happen. And then we decided, well, what would happen if we reached out and did engagements with the health advocates for the minority community, for the Native American, Hispanic, Asian Pacific Islander, and so forth, and partnered all of them. We did this town hall with all the advocates and their medical society. We partnered them all together. And the thing that was really weird for the Black folks was all the other communities were saying the same thing we were saying. We're afraid to walk the streets because of police brutality. We heard from the Asian Pacific Islander community, their seniors were all vaccinated, but scared to go out because they were worried about getting beat up by the people on the streets. Everything that we had that we thought was our thing was everybody else's thing across the board. And by the end of it, we were all realized the one reality: we are all in this together. Where do we go from here? We got to overcome this distrust and engendering respect for science. When we were fighting AIDS in the 80s, the number one risk factor for whether we would be successful in fighting AIDS was Tuskegee. Every damn radio show I went on as the health commissioner of Washington, D.C., fighting this was, well, what about Tuskegee? 40 years later, Tuskegee. How, I ask you this, how is it possible that in 40 years, the American research enterprise, the American clinical delivery enterprise, the American public policy enterprise did absolutely nothing to take Tuskegee off the table. Nothing. 40 years that has persisted and gotten worse. People we heard from our wonderful, just a minute ago about her friend who went to the hospital and got Tylenol. The distrust of the medical profession is rampant in the black community. And 40 years we did nothing. But you know, I'm angry at the American research, clinical care, and policy enterprise, but I'm madder more at we. Because we didn't challenge them. We didn't go to the doggone manufacturers who do the pharmaceutical companies that are running clinical trials. We didn't go to them and say, you know, you have done nothing to take this off the table. We were not pissed off enough. We let it slide. And now we get a pandemic and we're right back in the same place we were. So I got really pissed off about all the people calling, because 99% of the people that were on the radio show pissed off about Tuskegee don't even know what Tuskegee was. And yet they would use Tuskegee to say, well, now I ain't taking the vaccine because of Tuskegee, not even thinking about the fact that what Tuskegee was is we were denied access to the drug that would have saved our lives. So to show how pissed off I am about that, I'm not going to take the drug to save my life. What? Brother, that doesn't make any sense. So I said, well, wonder what the Tuskegee families are saying. So we picked up the phone. Y'all know I love the phone. I ain't afraid of calling people. All they can say is no. I ain't hurt. I ain't got that kind of ego. Fine, I ain't that important anyway. Say no. Call the families. What do y'all think about this? Oh, we got a lot to say about it because all of us are vaccinated. So here, send a film crew. Do I have money for a film crew? Ring, need help. Can you get a film crew down? Yeah, okay, cool. So this is what we got. Now prayfully. Come on now.
I am the daughter of one of the men in the study, Freddie Lee Tyson. I'm also the daughter of Johnny May Neal Tyson. I have to include my wonderful mother because the two of them was on the journey together. My father had congenital syphilis from his mother. When penicillin became available, the men were denied treatment. There has been a lot of references to the study as to why some people may or may not want to take the vaccine. A lot of misinformation is out there. We have the ability to find out the facts and the opportunity to talk with people who could help us go through the facts, and don't deny ourselves the opportunity the men were denied.
So I met, we put them all into a ballroom, and about 10 of them. They're the loveliest, nicest people you've ever want to meet. She's the daughter of one of the survivors. I remember that I was honored to give the keynote address to the first annual Tuskegee Syphilis Study Victims Ethics Institute down in Tuskegee. And I was all ready for my talk and came early and prepared. Thank God I didn't have to worry about my computer dying. And I was all ready to give my presentation. I was all excited. And before I spoke, they had the descendants walk into the room from the back. Hobbled, cane, walker, but possessed of the most consummate dignity. Consummate dignity. And the host asked one of them if they would like to make a comment. And they handed the microphone to this one brother. And he only had this simple message, 2 words. We forgive. That was it. We forgive. Now, that was the end of my talk. What else can you say? After that, we forgive. In other words, they were prepared to move on. They were prepared for their lives to be what they were. And yet, here we now have reams of other people who somehow think they're honoring that by killing each other. And so the family was just devastated. And by the way, about 6 or 7 of them are in the health professions. So very excited. I had another one I was going to play for you, but I'm going to move forward because we don't have time. So the next thing, and I'm closing out, so for those that are worried, but these are important. We've got to take full advantage of the redesign of the conceptual and reimbursement of the modern delivery system. Healthcare delivery is going through a major transformation. And the transformation it's going through is in our favor if we use it properly. The triple aim is the organizing principle, of course, around that, which is to improve the health of the population, reduce the per capita cost of care, and enhance the patient experience of care with quality, access, and reliability. So we're going to evaluate care delivery more and more coming up. So instead of us going to the docs and say, please take good care of us today and please care more about us, and no, we're going to evaluate the hell out of you. And we're going to make it so that your money is tied to how well you treat us. We're going to make it very clear. You see, people can't afford health care anymore. The health care costs have gone up to the point now where we are at the end of the road. There ain't no more money. The number of people that are in medical bankruptcy today is extraordinary. The people that cannot pay their copay or their deductibles is increasing. The number of rural hospitals that are going out of business because they can't pay their payroll, but then they're taking the people who are bad debtors in rural America to court, and they are in bankruptcy themselves, and you can see this spiral. So the cost escalation problem is extraordinary, combined with the quality problem. We have known since 2000 that we had this horrific quality problem. And now we've known since 2002 about how the disparate quality for black folk is significant. Look at the things that are on that page. That is what the National Academy of Medicine concluded as the solution to quality 22 years ago. Evidence-based decisions, cooperation among clinicians, because you know we have multiple chronic illnesses and we have to see more than one clinician. Anticipation of patient needs. The patient is the source of control. Care based on continuous healing relationships. Customization based on patient needs and what? Values. The community they come from. And then shared knowledge and the free flow of information. Make that your mantra. Make that your mantra. Make that come. That is still real today as it was anywhere. Evaluate everything that is happening in the healthcare delivery system in this state based on those criteria, and you will do well. You will do well as advocates. Look at what's happening because of the change in reimbursement. We were paying physicians fee for service, piecework. I give you, you make a sleeve, you get paid for the sleeve. You make a buttonhole, you get paid for the buttonhole. And now, of course, we're moving to, I'll pay you for the whole damn jacket, and that's it, leave out the pieces. Now the financial incentive is not for the clinicians only to be concerned with people on the right side of that slide being sick and not dying, but now going upstream because you want to identify who's about to be sick early. Because we have the data that lets us know that. If we can identify who's about to be sick, then you can intervene to keep them from tipping over to being sick, thereby taking money out of the practice, or keeping them well and thereby making money in the practice. So now there's an incentive for going up and looking at the physiological factors, resilience and spirituality, behavioral factors, in addition to how those all interact with genetics. And then going even further to physical environment and the social determinants of health. There is a logic here. There's a marriage coming between the clinical system and the public health system coming together theoretically for the first time. So now you got the child who is a black child asthmatic on Medicaid. And so you do as the clinical system does, you do everything you can. I'm going to try to go. I just need a couple more just slides and the problem and, you know, the whole thing. Dog ate my homework. The Medicaid asthmatic black child, you can open the clinics longer so that they don't have to go to the emergency room at night generating those bills. You can work with the parents on better use of inhalants and making sure they're educated how to use it best. You can use the first generation inhalants instead of the third generation as the start so you don't spend all that money. You do all those things. But then how do we go upstream into the housing project and clean out the heating ducts, the air conditioning ducts, cleaning out the rat droppings and the roach droppings, which are the allergenic precipitants of that. That's what we have to be able to do now, and join those two together. So you go to the governor and you say to the governor, we need a few more public health people to do that. They say, well, we ain't giving you no money for public health because we don't give a damn about public health. So what you then have to say is, give us a few, let us show you how much money we save Medicaid in the great state of wherever, and then we'll show you that it paid for itself multiple times over. We gotta be more aggressive in our thinking and use what we have available to make this happen. So that means, number 7, we gotta make sure we got data. Do you know how many health departments in this country refuse to collect data on race? Somewhere around 18 now. It's all politics, all cold-blooded. If we don't know, then we don't know. What problem? Here? We have no data that suggests there's an issue, because we have no data to suggest that there's an issue. We've got to have the data that makes it possible, first of all, for the delivery system to do what I just said. You've got to have the data to be interconnected, critical. Now, trust and distrust. Is the Black community prepared to have its data shared across settings of care? Do they want their data shared through settings of care? Have we prepared the community for the realities of the modern delivery system? We have not. We have not. And so we're going to have to make sure people understand why it's in their interest that data flows from this provider to that provider, and from this hospital to this clinic, and from this to the home in a decentralized health environment. We have work to do about helping people to get through the concerns around data. I only have 10 points, so don't worry, I'm almost there. So we also have to make sure that the data is not used to further exacerbate. Artificial intelligence. You all heard the terms. You understand a little about what it means. Let me say to you, Florida Health Coalition, you cannot do your jobs well if you are not facile in understanding what artificial intelligence is and how it is used in the current delivery system today. The reason you have to know that is because the algorithms must be clear. Garbage in, garbage out. The algorithms that are being used in too many cases are flawed based on racial assumptions and stereotypes, and just fundamental incorrect. That is the information that's being given to the delivery system upon which to give clinical care to human beings. We have to make very sure that these algorithms that are driving care delivery are basically fair and accurate and don't worsen disparities going forward. So we have to make sure that data is not going to be used inappropriately and worsen disparities. Number 8, I mentioned to you that we will have the data that will tell us who is at risk for what. The question then is, how do you communicate that information to that person in a way that they will use it? I come back to social media, to TikTok. There's something that they tell me, that the young people tell me, called Black Twitter. I don't know. I'm too damn old. But what I'm saying is this. People that are too damn old need to sit down when it comes to trying to figure out how to talk to Black people. It's time for the kids. It's time for the kids. How do you reach the people you want to reach in the modern era? This is not casual. It used to be, I was so excited when I was a health commissioner in DC, I would hand you my 4-color brochure. It's beautiful. Lots of nice pictures. Can you imagine doing that today? Here's my brochure. Just say no. It's stupid. This is science. This is sophistication. If you care, you got to be on your game. You got to be good. So how do we teach people to hear the information in a way that they can respond? Number 9 of 10 points, we got to solve for the consumer engagement and education in an increasingly complex landscape. Healthcare is going to be decentralized. People are not going to be in hospitals anywhere near like they were before. Care is going to be delivered in the home. And in the modern digital age, I'm the former president of the American Telemedicine Association. I will tell you, I understand this field of digital health. It is moving so rapidly. So you will have your in-home monitor, your glucose monitor in the home. You will have the burn or the wound managed through your smartphone being connected in with the delivery system. There are so many tools with your Apple Watch and your smartwatch and all of these elements, which are now going to be part and parcel of the fundamentals of how care is delivered. How many of our people are prepared to use all of these new things swarming around us in a way that is competent? How much energy have we spent educating the community to make use and to navigate in the modern world? Do you understand my point? This is not normally on the agenda for Black health. I'm begging you, put it on the agenda for Black health. You see, if you do not understand what the health beliefs are of an individual, how likely do they think something is going to happen? You're not going to reach them. If you don't know whether the person has any sense of self-efficacy, a sense of confidence that I actually can take the steps to solve my problem, they're not going to solve it. If they don't have a sense of control, if they don't learn skills, if those skills aren't reinforced so they build self-confidence. If we tell people, you got to solve the whole problem of your healthcare in one swoop, or let's just take some baby steps and go slowly over it. My point is, all of this is not only important for health, but because of the nature of health insurance, health benefits. They're going to be consumer-based. It's going to be basically on you. You're going to have policies that are very much now saying, it's on you. And you need to make sure that you're working this through. We have got to work hard. And in no place is that more important than genetics. mRNA vaccine to save your life from COVID, done in a record period of time, one of the greatest achievements in human history. They're trying to kill me. It's a terrible plot by the white man to kill us all. Which way is it? Angelina Jolie, famous actress, beautiful woman, had breast cancer and a predisposition to other cancers in her reproductive system. She didn't have a diagnosis of yes or no. She had a diagnosis of probabilistic statistics that something is likely to occur. And she had to make decisions. You understand what I'm saying? Probabilistic statistics. Genetics is now the basis of medicine in America. I was lucky enough, again, to serve for many years as the chair of the Secretary of Health's Advisory Committee on Genetics, Health, and Society. I have seen how rapidly this revolution has taken on. How many people in the Black community have had a course in statistics or in probabilistic decision-making? How many doctors have had a course in how to communicate that? How many genetic counselors are in America? Oh, you ask. Good question. 5,000 certified genetic counselors in America. Maybe 6,000 this year with graduation. We have a big challenge. You didn't know that this was on the agenda for Black health advocacy, did you? We have got to help people do it. And then last slide and the last point. Where do we go from here? Communities have to empower themselves. We can't wait for the white man to come in and save us. No people but a people can save a people. While we are reaching out with love and affection to everybody, people of goodwill, we've got to recognize that the Calvary ain't coming anytime soon. And so what do? We either decide to call up like we did and say to the hip hop guy, in our case in DC, it's Anwan Big G Glover. I wear my mask and you should too. This ain't over. Anwan is in DC, it's go-go music. And Anwan is the go-go star. And so we called Anwan. Anwan, kids ain't wearing their masks. We called up the metro system and they said that if we can make a poster, they'll put it on every bus traveling through the Black community and in the metro stops for free. They gave us that. Again, ring, metro, your bus drivers are getting ready to get killed by people spraying COVID all over them. You need to do something about it, so let us put a poster on there to tell these people that are getting on the bus to have their mask on. Good, makes sense to us. Just send us the thing and we'll put it on the bus. So we call Anwan up. Anwan, you're the guy. Don't be scared like the rest of them. Don't be like Kyrie. Don't be like all the other big name entertainers who were scared of messing with their brand. Everybody loves Ali until they got to do something. Everybody loves Ali. The only one who ever threw the money back at their face and said, I ain't messing with my principles, take the money, I ain't doing it. Yet every one of these big time athletes, not everyone, but a whole lot of them, were afraid that their core, the hardcore black community, would never accept them if they were the ones pushing forward the messages on COVID. And so they went south on us. Anwan stood up to the plate and we got him to do it. We picked up, and this is the end of the story, but so we said, well, what would be good to tell the story? So we got a spoken word contest. So we went and got all the kids. I took $1,000 out of my pocket and put it on the table and said, the winner of the spoken word poetry contest, who can translate all of our scientific gobbledygook into something that y'all like and listen to, you get $1,000. And the second prize winner gets $500 and third gets $250. And people all over the city wrote in. And the winners were incredible. Some of them were like, the winners were like really young. So we said, that's pretty cool. And they did it. And we sent, and people were like, so we said, what if we told people to make a video on their cell phone while I wear my mask? Now you can make a great video. For old people like us, you may not know this, but young people like you know that you can actually make a video on your cell phone like that for no money. So we make a video of why I wear my mask. The winner was a 9th grader. Made the greatest video I've ever seen in my life. The mayor of the city put her up there and beside her and said, look, y'all got to see this. I mean, the system was bad. You see my point. We don't need a grant. We don't need a grant. We don't have to wait for, well, we can't do nothing because the grant. Man, go just pass the hat. It drives me crazy. My last slide is this. We're not letting the federal government off, though. So some of the warriors and warriorettes are meeting regularly now with the HHS in the White House. And we are saying to them, we are sick and tired of these big white companies getting the contracts and then doling out pieces to the black community. Please, sir, can we have some more? No, cut them fools out. They get all the money, all the overhead, and we don't have anything to show for it at the end of the day. And so I just want you to know that we're going to continue to fight like crazy for that. My last slide in the end, and I want to thank you all much, and I apologize for going a little over, and I apologize for the technical glitches. I tried to be a little more professional, and I was so professional that I killed myself and let the battery run out. But I do want to read you this, and I will end with this. And then it won't be time for questions, but I'm sorry. So, you mean to tell me that someone down your ancestry line survived being chained to other human beings for several months in the bottom of a disease-infested ship during the Middle Passage, lost their language, customs, and traditions, picked up the English language as best they could while working free of charge from sunup to sundown as they watched their babies sold from out of their arms and women raped by ruthless slave owners, took names with no last names, no birth certificates, no heritage of any kind, braved the Underground Railroad, survived the Civil War to enter into sharecropping, learned to read and write out of the sheer will and determination, faced the burning crosses of the KKK, averted their eyes at the black bodies swinging from ropes hung on trees, fought in world wars as soldiers to return to America as boys, hosed in Birmingham, beaten in Selma, jailed in Wilmington, assassinated in Memphis, segregated throughout the South, ghettoized throughout the North, ignored in history books, stereotyped in Hollywood, and in spite of it all, someone in your family line endured every era to make sure you would get here. Now, if you receive one rejection, face one obstacle, lose one friend, get overlooked, you want to quit? How dare you entertain the very thought of quitting? Perhaps you will never know how people you will never know survive from generation to generation so you could succeed. Don't you dare let them down. It's not in our DNA to quit. It's not in our DNA to quit. Thank y'all very much. Sorry that I was a little long. I really apologize.